It's the AEMT lecture series. Welcome back. This will be video number 2 for chapter number 11, Airway Management. We left off here at factors affecting ventilation. We've had this, we know this information, so we get that. I would review that though, because there's lots of factors that can affect ventilation. Anything from, they talk about intrinsic, extrinsic factors, hypoventilation, respiratory acidosis, respiratory alkalosis. We should know that. We know that if we have an increase in CO2, our respirations are going to increase. And if we have a decrease of CO2, they're going to decrease. All right, so we can kind of figure that one out. So here, if you look at, let me back up real quick. We can have factors from mechanical factors, rib cage, several broken ribs that makes the person not want to inhale. We can have external factors, and here they are: attachment of carbon monoxide molecules to hemoglobin, right? So it's wintertime, and somebody has their lots of CO gas in their house. Okay, it's blocking hemoglobin from transporting oxygen. And we have internal factors. So this is conditions that reduce surface area for gas exchange, right? And that could be from asthmatics, that could be from pneumonia, that could be something going on with alveoli, etc. We could have intrapulmonary shunting. That's blood that's going to be entering the lungs from the right side of the heart, but bypasses the alveoli, okay, and returns to the left side unoxygenated. And that could be a bad day. And then we understand circulatory compromise, like, something's going on, traumatic, spleen, liver, we're bleeding out. That would be, a way that the blood can't get back to the alveoli to make a gas exchange. Pulmonary embolus, a pneumothorax, stuff like that. And I'll let you review these. I'll let you guys understand. We've already covered respiratory, metabolic alkalosis, and acidosis. Remember, guys, when we're looking at breathing, the rate is not everything, right? Somebody can be breathing, 8 times per minute, but if they have adequate chest rise and adequate tidal volume, then that patient's breathing normal. But if they're breathing 8 times per minute and they do not have adequate chest rise and they do not have adequate tidal volume, then this could be somebody who needs to be bagged. They could be in respiratory failure. Don't sell the farm based on a respiratory rate. When you're testing and you get something, they usually will tell you the patient's breathing 12 times per minute with adequate or inadequate, 10 times per minute with adequate or inadequate. But if they tell you 10 times per minute and they don't tell you it's adequate, then you got to assume that it's low. That's just what you're going to assume. But in the field, when we're assessing a patient, 10 times might be enough. And then when you're assessing a patient in respiratory distress, their positioning will mean everything. You've seen it before. You've come in the house and somebody will be laid up, curled up on the couch, and you'll introduce yourself and you'll ask what's wrong, and they'll tell you they're having a hard time breathing. Well, probably not. As opposed to somebody you approach that's in a tripod position, speaking in 2 to 3 word sentences. Yeah, that person's in some distress. All right, let's see here. 1 second. So absolutely. So positioning of the patient, chest rise and fall. Are they gasping for air? Do they have pursed lips? Are they using their muscles in their chest cavity to breathe? Are they using accessory muscles? Is their chest rising and falling equally? Oops. Signs of inadequate breathing. So a respiratory rate of fewer than 12 breaths per minute or more than 20 breaths per minute. Now, that's signs of inadequate breathing. So I would say less than 12, right? But if I tell you they're breathing 12 times per minute and they have adequate chest rise and fall, then that's a normal person. So if you get a test question, it says they're breathing 10 times per minute, but you don't get adequate chest rise and fall, then yeah, you got to assume that that's going to be inadequate, right? An irregular rhythm, right? They're not talking about the cardiac monitor. They're talking about the rhythm of breathing. All right. Do they have diminished or absent lung sounds when you're listening to them? Are they breathing more from their abdomen area? Unequal or inadequate chest expansion is the big one. So we're going to look at position. We're going to look at, are they experiencing orthopnea, right? So understand what that means. So are they experiencing more trouble breathing when they're walking, right? Moving around. What's their skin condition like? Is it moist, clammy? Nasal flaring. Is their nasals, can you see that? I backed up here. Okay. All right, chain stoking. You need to know that. You need to know chain stoking. Okay, may result in irregular, ineffective respirations that may or may not have an indefinable pattern like this, right? So you have, this is the rhythm, and then they become apneic, and then they start over again. So their breathing increases a little bit, starts decreasing, apneic. All right, then they start up from there, breathing a little more, and then they start falling off again. So no table 11.5 in your book. Serious head injuries may also cause changes in the normal respiratory rate and pattern of breathing. Okay, and understand that respirations may or may not have a definable pattern. That's called ataxic respirations. Agonal gasp, we know what that is. All right, give me 1 second. All right, so the rest of this basically is knowledge that you guys already have. And then we get into skills, which are a lot of these skills are EMT skills that are in here. It'll just be a refresher for you guys. So I think 2 videos for this chapter are going to do it. I'm going to put the videos out and then put the study guide for the next test up. So we will see you guys on the next video. You guys continue to study hard and look forward to seeing you soon.